Hi there, welcome back to Optimal Anesthesia Insights. Today, we're diving into something critical for every anesthesiologist: how the aging cardiovascular system affects our anesthesia practice. Let's break down the fascinating first stages of cardiovascular aging and how they impact what we do in the OR. Trust me, this knowledge could make or break your next high-risk case. First, let's understand why this matters. The heart and vascular system are a dynamic duo. As they age, the changes are closely linked: stiffening arteries, rising blood pressures, and a heart that works harder just to keep up. Let's explore these changes in stages. Stage 1 is all about the aorta. With aging, the elastic fibers in the aorta start to fatigue and even fracture. The stress shifts to stiffer collagen fibers. The result? Aortic dilation, increased systolic pressure, and, you guessed it, a widened pulse pressure. For us in anesthesia, this means the elderly patient's blood pressure may seem stable at rest but can surge unpredictably during stress, like induction or intubation. Always prepare for rapid hemodynamic changes. Stage 2 takes us deeper. Stiff arteries speed up pulse waves. In young patients, reflected waves return to the heart during diastole, helping coronary perfusion. But in the elderly, these waves bounce back during systole, adding extra pressure on the heart. This phenomenon, called isolated systolic hypertension, increases myocardial workload. For us, it means keeping systolic blood pressure in check, especially during surgery. Remember, even small fluctuations can strain that aging heart. Stage 3 is where things get more complex. Poor buffering by the stiffened aorta sends high pulsatile pressures to sensitive organs like the brain and kidneys. Ever heard of pulse wave encephalopathy? Those white matter lesions you see on MRI? They're caused by this process. In anesthesia, we need to ensure controlled blood pressures to protect these vital organs, especially during lone surgeries. And finally, stage 4, the heart itself feels the pressure, literally. Left ventricular hypertrophy develops as the heart struggles against the high late systolic pressure. Diastolic dysfunction creeps in, meaning the heart doesn't fill as effectively. For us, this changes everything. Elderly patients rely heavily on atrial kick to maintain cardiac output. Tachycardia? They won't tolerate it well. Hypovolemia? A disaster waiting to happen. Carefully titrated fluids and rate control are key. So, what does this mean for us as anesthesiologists? Let's recap the anesthesia implications of cardiovascular aging. Blood pressure management: avoid wide swings. Both hypo and hypertension can be harmful. Heart rate control: the elderly heart doesn't like to race. Beta blockers and gentle induction agents can help. Fluid management: overloading a stiff heart can worsen diastolic dysfunction. Use small, cautious boluses. Organ protection: watch out for the brain and kidneys, ensure stable perfusion pressures throughout surgery. Cardiovascular aging is a journey, and as anesthesiologists, we play a vital role in guiding our patients safely through it, especially during surgery. By understanding these changes, we can anticipate challenges and tailor our strategies for better outcomes. Don't forget to check out the detailed article on this topic on our website, optimalanesthesia.com, where we share the latest evidence-based insights. Thanks for watching. If you found this helpful, give it a thumbs up and share it with your colleagues. And as always, subscribe for weekly insights to elevate your anesthesia practice. See you next time.